And Kenya's health docket is yet again set to witness change of guard following the nomination of Dr. Deborah Milongo Barasa by President William Ruto Friday, when he named a partial cabinet comprising of 5 new nominees. Experts argue that the crucial docket that witnessed drastic policy shifts under the tenure of former Health Cabinet Secretary Susan Nakumincha requires someone who understands public health policy, public health systems, and also one who understands how the devolved units work. The question that abounds now is whether Dr. Barasa, who is said to have over 15 years field experience as a senior medical officer, will be the one to help President Ruto deliver his health agenda in the event her vetting sails through. Our health and science reporter, Gloria Milimu, has more.
The health docket has over the years remained one of the crucial ministries for any government of the day in Kenya. After all, experts argue that in many ways, the health of a nation directly influences the life expectancy and overall well-being of its citizens. So much so that they equate this well-being to development, since a healthy population contributes to quality of life. But over the years, different regimes seem to have faced hurdles in the delivery of this crucial element of development, informing changes at the helm of the Ministry of Health leadership.
The issues that you have raised.
Friday's changes came after pressure mounted on President William Ruto to pick competent people who can help him deliver his agenda. The president bowed to pressure and nominated Dr. Deborah Milongo Barasa to be the country's next health cabinet secretary.
I also promised to consult widely on the way forward, and I also promised to craft a broad-based government that would harness the enormous potential in our country.
Let her put her credentials very clear outside there, because we have a Gen Z, the new sheriff in town, that knows how to mine the data. So let us just be authentic and truthful to who she is.
Health policy advisors, however, warn that the task ahead of her, should the vetting exercise sail through, is one that will require an array of skills in a bid to navigate the technical ministry that also heavily requires policy posturing.
She will need to look at how then her public positioning is going to be. What are the utterances? How is she going to, her communication? Of course, she has to communicate because it's a political position, but how then do you balance your technocrats and your political acumen? So she must get a middle ground of doing that.
Dr. Sadia advises that the position also requires one who is well conversant with the 6 building blocks of health that touch on health financing, human resource for health, quality assurance, among others. Others of the contrary opinion say the sector requires someone who has managed huge programs and interacted fully with those 6 building blocks. They argue that all these blocks require tweaking for public health systems to deliver on critical health systems outcomes, which include quality and equity.
You must also have guts, because the political appointments sometimes drive you a certain direction. You must be able to navigate that, really convince them by evidence. This is not going to work. You are not just going to be driven like a car. Sometimes you have to put your foot down and say no. In terms of medical practice or evidence that we have, that will not be able to tick. So I think that is a value that she needs to go. She must be very authentic leadership. She must be able to sometimes stand her ground and say, this may not, it is an investment that may be wasted if we go. Because she doesn't want to be populist on the political side and leave the technical side lacking.
On the other hand, the former Health Cabinet Secretary Susan Nakumincha, just like some of her predecessors, encountered hurdles that tainted their stint while serving at the helm of the Ministry of Health leadership. Critics say she found herself in the middle of a storm due to her alleged inability to get proper advice and failure to understand the distinctive roles of both tiers of the government, considering that the sector is devolved. They reckon it might have contributed largely to the woes that bedeviled her tenure, like the recent health worker strike they say portrayed her as someone who lacked empathy for her workers because of how she handled the impasse. But some of these challenges are not quite unique to her. Her predecessors also suffered the same fate. For instance, former Health Cabinet Secretary Mutahi Kagwe also had his fair share of the doctor strike in 2020. His predecessor then, Cicely Kariuki, was moved to the Ministry of Water, Sanitation and Irrigation after former President Uhuru Kenyatta reshuffled his cabinet in January 2020 at the height of COVID-19. She also survived a motion to impeach her in 2018 that saw 170 members of parliament sign a petition seeking her removal from the health CS position for abuse of office and gross misconduct. Before her was Dr. Cleopa Mailu. During his tenure, he also encountered challenges like loss of funds at the Ministry of Health that forced him to return at least 160 million shillings to donors that could not be accounted for to save children from missing out on essential vaccines in 2016. Overall, for the health nominee, it will definitely not be a walk in the park, considering that the court also suspended the implementation of the Social Health Insurance Fund, the new health financing model that the Kenya Kwanza government is banking on for the delivery of universal health coverage. All eyes will now be on the nominee as she undergoes vetting before settling at the ministry. Gloria Milimu, KTN News.